Okay, so regarding the lower limb, I told you you will get one station from your anatomy from the lower limb. So out of 3 stations, you might get one station from the lower limb, and there's a huge chance of getting the lower limb in your real exam. And if you consider the lower limb has been divided into 3 parts. That is basically the uh, hip area or hip joint and surrounding structures, and the thigh and the knee, then ultimately the sole or the ankle joint. And mostly you will get nowadays they are mostly uh, giving the questions from the uh, gluteal region as well as the thigh, especially the posterior thigh as well as the popliteal fossa. And this area is very, very, very famous for the surgeon. And they used to give questions from the ankle, and in the ankle they will ask you to identify several ligaments, and the ligaments are very simple to identify if you know the proper orientation. Just simply look at the place. I will show you the tricks how to identify the medial side or lateral side, and always you'll have to remember what are the ligaments are supposed to present there. So if you can remember like this, sir, and that will be really, really easier for you. So let's start. Okay, so at first come to the book. Okay, so this is our book. So we learn about these topics, and mostly the gluteal region, thigh muscles of the thigh, especially posterior compartment, and the popliteal fossa. These are very famous for the MRCS OSCE exam. And another thing that is the foot and the ankle joint, mostly the ligaments. This is another favorite topic for the MRCS OSCE exam. So we'll have to give extra more emphasis on particularly on these topics. Okay, so at first this is a hip bone, right? Now tell me, uh, what are the parts of the hip bone? What are the parts? How many parts?
Three parts,
Yes,
three
yes,
parts
yes.
total.
So this is now tell me what is,
Ilium,
yes, ileum.
Ilium.
Yes, very good. And this is
ischium,
ischium, and this is
pubis.
right. Very good, very good. Okay, now tell me which sided hip bone is this? Which sided hip bone?
Right-sided,
Is right sided? Okay, right side. Now tell me why you are saying this is a right sided hip bone.
because the anterior superior iliac spine lies anteriorly and
Okay,
posterior superior iliac spine lies posteriorly, and the
okay.
acetabulum lies laterally. And
Yes, that is enough. That is enough. So anterosuperior iliac spine. This is the anterosuperior iliac spine. This is the anterior inferior iliac spine. This is the posterior superior iliac spine, and this is the posterior inferior iliac spine. And this is the acetabulum. So this line, and this is the pubic tubercle. So this line lies in the horizontally, and another in the same line basically, and the acetabulum lies backwards and outwards, and this posterior superior iliac spine and posterior inferior iliac spine lies posteriorly, and this is the ischial tuberosity. So we'll have to learn the bony landmarks and bony points of the hip bone. What is this? Someone tell me, what is this?
Anterior superior iliac
Yes,
spine.
and what is this?
Anterior inferior iliac spine.
What is this?
Posterior superior iliac spine.
And this one?
Posterior inferior iliac spine.
Okay, and this one?
This
This is
one
the
ischial tuberosity.
tuberosity. Very good. This is ischial tuberosity, and this one is the acetabulum. And particularly this one, we have discussed this thing in the abdomen class, and this is called the iliac crest.
Crest.
The iliac crest.
Crest.
Okay, now we are looking the hip bone from the outside. Now is the inside. So there is a one thing you'll have to remember, only simple thing. This is the L of the ilium. This is the L of the ilium. Rest of the part are same. And one thing, this is the greater sciatic notch, and this is the lesser sciatic notch, and this is the scale spine, and this is the symphysis pubis. Okay, and this is the obturator foramen. Nothing is needed other than. So don't waste your time by reading these. No, these are not needed. Just I am telling you, you will have to give emphasis where I am asking you to do. Don't give and give extra efforts somewhere else, and I am not telling you to do so. So always try to follow us, and definitely that will help you. Okay, now this is the ilium, and here you will have to remember three things. Number one, this is called anterior gluteal line. What is the name? This is called anterior gluteal line. Guys, talk to
Yes.
me. This is called anterior gluteal
Anterior
line,
gluteal.
and this is called posterior gluteal line, and this is called inferior gluteal line. So how many gluteal lines are present in the gluteal surface? There are
3.
gluteal lines. Number one, what is this? This is called anterior
Anterior
gluteal line.
gluteal
It's
line.
called posterior gluteal line, and this is called the
In
Inferior.
inferior gluteal line.
okay. So how many gluteal muscle do you know
3.
are there? Yes, there are
3
three
gluteal
gluteal.
muscles.
The gluteal maximus originates from behind the posterior gluteal line. From where gluteal maximus originates? From where?
Behind the posterior gluteal line.
Okay, that means
Posterior ilium.
this is the posterior gluteal line, behind the posterior gluteal line, right? This is the gluteal maximus. Okay, and this area, particularly this area, is in between the anterior and posterior gluteal line. Are you clear, guys? And
Yes.
from here, gluteal medius muscle originates. So if you are asked from where the gluteal medius muscle originates, someone tell me what is the origin?
Between the anterior and posterior gluteal line
Yes,
of the
between
ilium.
the anterior and posterior gluteal line. Okay, so this is the anterior gluteal line, right? And this is the inferior gluteal line. And from here, the gluteal minimus. Which one is left? Gluteal
Minimus.
minimus. And gluteal minimus originates from the anterior gluteal line and the inferior gluteal line. This is the inferior and this is the anterior. So in between the anterior and inferior gluteal line, gluteal minimus originates. So there are three gluteal lines are present in the gluteal region. One is gluteal maximus, gluteal medius, and the gluteal minimus. Am I clear to you? Am I clear to guys?
Yes, sir.
Okay.
Yes, sir.
We'll discuss this thing later on again, no problem. So these are the parts. These are the parts you'll have to remember. If you want, you can use also this is the scale spine, not needed for the OSCE exam. Okay, someone please. I am nominating Dr. Arman. Arman, are you here, Bhaiya? Yes, rapidly. Dr. Arman, are you here? Okay, he's not here. Dr. Deep, are you here, Bhaiya?
Yes, sir.
Okay, so now tell me, what can you see? What can you see?
It is sacral bone.
Okay, hip bone, not the sacral bone.
Hip
Is it
bone.
the sacral?
Hip bone. Sorry, no, sorry, hip bone.
Is that hip bone, right? Sacral bone lies in between the hip bone, right? Okay, hip bone basically is a fusion of three bones, right? We have already discussed. Now tell me which sided hip bone is this?
Left-sided.
Okay, very good. Now tell me what is number 5?
Anterior superior iliac spine.
Okay, anterior superior iliac spine. What is number 4?
Anterior inferior iliac spine.
Okay, very good. What is number 23?
Posterior superior iliac spine.
Yes. What is number 22?
Posterior inferior iliac spine.
Okay, excellent. Now tell me what is number 3?
3 is posterior gluteal line.
Is it posterior gluteal line?
Anterior,
So
anterior
okay, no problem, no
gluteal
problem.
line.
Don't be panic. No problem. So this is the anterior gluteal line. Very good. Now tell me what is 21?
This is posterior gluteal line.
Okay, posterior gluteal line. Excellent. Now tell me what is 12?
Inferior gluteal line.
Okay, excellent. Very good. Now tell me which muscle originates from in between the inferior and anterior gluteal line. Number 3 is for originate of
Gluteus minimus.
gluteal minimus. Very good.
Yeah.
So what is originating from the posterior and anterior gluteal line? That means this area.
Gluteus medius.
Okay, excellent. And which muscle originates from behind the posterior gluteal line?
Gluteus maximus.
Okay, so you covered almost all the questions very carefully and excellent performance. Okay, now I'm telling you this is called the anterior superior iliac spine. And here I don't know whether you have remembered this or not. This is the outer lip of the iliac crest, and especially anterior two-thirds of the outer lip of the iliac crest is the origin point of which muscle? Which muscle?
External oblique. External
Yes,
oblique.
yes.
Lateral
External.
two-third of the outer lip of the iliac crest.
Yes, very good, very good. So this is the origin of the external oblique. Am I clear to you, everyone? Am I clear
Yes.
to you?
Yes,
Okay. Now this is the anterior superior iliac spine. So basically, if I want to show you, just wait for a while. I'm just picking a picture. Okay, come to this picture. It's not enough. It's not showing here. Okay, whatever. So just have a look in this picture. So basically, this is the anterior superior iliac spine. This is the anterior superior iliac spine, and this is the symphysis pubis basically. And just lateral to the symphysis pubis, this is the pubic tubercle. And a ligament, this is the external oblique, originating from the external oblique muscle. This ligament form, and this ligament is known as the inguinal ligament. So if you are asked which structure originates from number 5. Now tell me which structure originates from number 5.
Inguinal ligament.
Yes, this is the originating power area of the inguinal ligament. Just below the inguinal ligament, there are another structure is arising. Just this area is originating from the, could you tell me, someone? From the sartorius muscle.
Sartorius muscle.
This. That means from the anterior superior iliac spine, the superior one is the originating from the inguinal ligament, and the inferior area is for the sartorius. Am I clear to you? Am I clear to you?
Yes,
Okay, am I clear to you? Now come to number 4. This is the anterior
inferior.
Inferior
iliac spine. Okay. This is also again divided into 2 areas. How many areas? 2 areas. Above this area, this area basically is the area of the originating of the rectus femoris. Which muscle? Rectus femoris. Basically, rectus femoris has 2 heads. What are the heads? One is reflected head, and another one is straight head. And straight head basically arising from this area. Now you should have a question from where reflected head is coming from. Just upper lip of the acetabulum. Am I clear? So how many heads
Yes,
are
Yes,
there of the rectus femoris? How many heads are there of the rectus femoris? There are 2 heads.
2 head.
One is straight head and another one is reflected head. And straight head is coming from the inferior iliac spine. Straight head is coming from the inferior iliac spine, and reflected head is coming from the
Rim of the acetabulum.
yes, very good, rim of the acetabulum. I think it's clear to you. And you can ask me what is the another point. This is basically from lower portion. There is another structure is coming from, that is called the iliofemoral ligament. But that is not important for your exam. You'll have to remember the thing I am telling you, only the thing. Okay, am I clear? Am I clear?
Yes.
Okay, now we are coming to number 22. Yes, number 22. This is called the posterior, posterior inferior
Inferior iliac
iliac
spine.
spine. And from this area, basically one muscle is coming here. This is called, do you have any idea which muscle?
Piriformis.
Yes, piriformis. Piriformis. Piriformis muscle. So from the posterior inferior iliac spine, piriformis muscle is coming. Now we'll come to this area. This area. Okay. So do you have any idea what are the muscles of the posterior compartment of the thigh? What are the muscles of the posterior compartment of the thigh? Do you have any idea?
Yes, semitendinous, semimembranous,
Yes,
biceps femoris.
femoris. And biceps femoris has how many heads?
Two
Two
heads.
heads. One is long head and another one is
No.
short head. Always remember from this area, the muscles of the posterior compartment of the thigh is coming from. From this portion, semimembranosus is coming from, and from 15 semitendinosus. And which muscle are remaining? Which muscle are remaining?
Biceps femoris.
Biceps femoris. Biceps femoris is just simply originating along the semitendinosus. Basically, the long head, and short head is coming from the femur, not from the ischial tuberosity of the hip bone or the hip bone. Am I clear to you? Am I clear to you?
Yes, bhaiya.
And if you want, you can also add the adductor longus is also coming from this hip bone. Adductor longus. I think we are this is enough for the hip bone, especially what are the important muscles are originating from here and what are the important structures. Okay, are you getting me, guys? Do you have any question after this portion? Yes, tell me. If you do have any question, just tell me. At least talk to me like you are
No,
getting.
bhaiya.
Okay. And okay, if you are getting me, then answer this question. I'm nominating which one? Who is interested to answer? We will help you, no problem. Dr. Ratna, are you here, Apu?
Yes, bhaiya.
Okay, so this is your part. Now start. Now tell me, what is this?
Which one? Anterior iliac spine.
Okay, so now tell me, which structure coming from here?
External oblique.
Very good. And which structure coming from number 10?
Number 10 is inguinal ligament.
Yes. And which one from number 16?
Sartorius.
Yes, excellent. And now tell me, what is this? Which part of this bone?
Anterior inferior iliac spine.
Very good. Now tell me, what is number 19?
Rectus femoris.
Yes, which head?
Straight
Head. And which structure is coming from this number 15?
Reflected head of rectus femoris.
Okay, very good. Now tell me, which part of this bone prominence? What is this?
And posterior inferior iliac spine.
And which structure is coming from number 13?
Piriformis muscle.
Okay, very good. Now tell me rapidly, which line this one?
Anterior.
Yes. Anterior gluteal line. So which line this one? Which line this one?
Posterior gluteal line.
Yes, posterior gluteal line. And which line this one?
Inferior gluteal line.
Okay, Very good. And what is the bony prominence? This one?
Ischial tuberosity.
Okay. So which structure is coming for number 17?
Semimembranosus.
And what is number 18?
Semitenosus.
And
Biceps femoris.
long head of the biceps
Biceps
femoris, and short head of biceps femoris is originating from femur. From
femur.
femur. Yes, very good. And though it is not important, but still, if you want, which structure is coming from number 3? Yes, we can listen a sound of your baby, I think.
Yeah.
Okay, that's great. And which
Sorry, Bhaiya, I forgot this one.
no problem. Okay, so someone please help Dr. Ratna. Which structure is coming from here? Adductor?
Long head. Erector longus.
Magnus, right? Adductor magnus. Very good, guys. Very good. So I think it's always covered in the class, right? So it's a very important thing. Okay, just this picture is for your practicing purpose, just only to have some orientation along about the structures. I have already showed you this picture. Okay, so this is the inguinal ligament, and these are the this is the femoral triangle. Basically, all of you know that this is the sartorius muscle. Sartorius muscle. This is the femoral triangle. We'll discuss this thing again. Just have some idea. Okay, this picture is for you basically. Just the thing we have discussed right now about the bony origin now come from the muscle. So have a look. Have a look. This is the midline. Here is the sacrum. So this is the right side, and we are looking the patient from the back side. Okay. So the most superficial one and the largest muscle coming from just near the sacrum behind the posterior gluteal line. This is nothing but the which muscle? This one?
Gluteus maximus.
Yes,
Gluteus maximus.
maximus. Yes, is the gluteus maximus. Okay, gluteal maximus. Basically, this is the femur. Okay, I'm just coming to the femur at first, then we'll come to this part again. Okay, so this is the femur. This is the femur. Femur has this is the head, is the neck, and this is the shaft, right? And this is called the greater trochanter. This is called the, what is the part of this bone? Is called the greater trochanter. Greater trochanter. And this is called the lesser trochanter. And these trochanters are very, very, very important for your MRCS exam. Always remember that, especially the attachment, very important. So in this lesser trochanter, basically psoas major muscle, psoas major and iliacus muscle inserts. I'll show you picture later on. And behind the, so this is the from the front and this is from the back. Here you will get one line. This is called the pectinate line or the spiral line. Which line, Bhaiya? Which line? Which line? Pectinate line or
Pectinate or
spiral?
spiral line.
Okay, just come here. So just above the pectinate line, here it is not completely seen. This is called gluteal tuberosity. This is called the gluteal tuberosity. So basically, gluteal maximus muscle is coming like this way and inserts in this gluteal tuberosity or the back of the femur. Back of the femur. Am I clear? So if you are asked where gluteal maximus inserts, what would be your answer? Where gluteal maximus inserts?
Tuberosity.
Gluteal tuberosity. Am I clear to everyone? Gluteal tuberosity. Okay. Have a look. This is the greater trochanter. The greater trochanter. Here, the both gluteal medius and the minimus gets inserts. That means, if you are asked what about the origin of the gluteal muscles, that includes gluteal maximum. What about the insertion of the gluteal muscles? That includes all the three muscles. So, what is the insertion of the gluteal minimus, Dr. Jaffrey? What is the insertion of the gluteal minimus, Apo?
Minimus is greater trochanter.
Yes. What is the insertion of the gluteal maximus?
Gluteal tuberosity.
Yes, very good. Along with iliotibial tract, we will come to this part later on again. Okay, sorry. Okay. Okay. Now tell me, which muscle this one? Which muscle this one?
Gluteus maximus.
And gluteal maximus inserts into
Gluteal tuberosity.
of humerus, right?
Yes, sir.
Humerus.
Femur.
Okay.
Femur.
Yes. In the femur, right? So after that, which muscle will come? This is called the gluteal medius.
Medial.
And medius is coming from which line? In between the
Medial.
Anterior and posterior
yes,
gluteal line.
yes, very good. And it has been cut and reflected. After that, the gluteal minimus will come. So have a look. Gluteal medius and minimus inserts into the same point bone or greater trochanter, but medius always lies superficial to minimus. Am I clear to you? Am I clear to you?
Yes, ma'am.
Okay, okay, just let me show you another picture. Okay, no picture is available. Okay, have a look in this picture. So this is the sacrum. This is the sacrum. Dr. Deep, this is the sacrum, right? The anterolateral portion of the sacrum from where this muscle originates. This is called the piriformis. And this part of the hip bone is known as the greater sciatic notch.
Mhm.
And this piriformis muscle originates also in the posterior inferior iliac spine. So it is originated from the posterior inferior iliac spine as well as the anterior lateral portion of the sacrum, from where this muscle originating, and this passes through the posterior superior iliac spine and comes by this way and ultimately inserts here. So have a look. This is the inserting point of the piriformis. Am I clear? Am I clear, guys?
Yes, ma'am.
And this piriformis muscle basically divides the greater sciatic notch into two portions. One is structure above the piriformis and structure below the piriformis. Am I clear to you? Everyone, let me know. So
Yes, ma'am.
this is the piriformis muscle. This is the piriformis muscle. And what are the structures are coming above the piriformis muscle, and what are the structures are coming below the piriformis muscle? That is important, but all the structures are not needed. Only the structure that is for your exam, that is important. Okay. Above the piriformis muscle, the superior gluteal line. Which muscle? Which nerve? Everyone tell me. Which nerve?
Superior gluteal.
Superior gluteal nerve.
Gluteal nerve. Superior gluteal nerve will come above the piriformis, and the root value is lumbar 4 to sacral 1. And this nerve, just have a look, this nerve supplies the gluteal, which muscle? Gluteal
Medius.
minimus and
Minimus.
minimus. But is there any supply to the gluteal maximus?
No.
So what is the nerve supply of the gluteus
The
medius and the minimus?
inferior gluteal maximus.
Yes. So what is the nerve supply of the gluteal medius and the minimus?
Superior
Superior
Yes.
gluteal nerve.
So superior gluteal nerve and superior gluteal vessels are coming above the piriformis muscle. Am I clear to you? And below the piriformis muscle, these two nerves, this is called the sciatic nerve. Sciatic nerve. Sciatic nerve is coming below the piriformis muscle and along with the inferior gluteal nerve. And what is the root value of the inferior gluteal nerve? That is number 5 to sacral 2. Number 5 to sacral 2. And this nerve is supplying the which muscle? Which muscle? Someone tell me.
Yes, maximus.
Gluteal maximus. So rest of the structure, infragluteal vessels are coming below the piriformis muscle. Also the pudendal nerve, interpudendal vessels. So I think it is the pudendal nerve. This is the pudendal nerve. Pudendal nerve is coming also the below the piriformis muscle. You will have to only remember sciatic nerve, infragluteal nerve, and infragluteal vessels. If you want, you can also remember the pudendal nerve. Am I clear to you? Everyone, am I clear to you? Just tell me.
Yes,
Just
yeah.
tell. Yes. Okay. Now I think I should nominate someone. Dr. Sabir Bhaiya, are you here? Young man. Sabir, are you here, Bhaiya?
I will come later. Now I
Okay, I think you joined later, right? Okay, no problem. Dr. Mahmudul Hasan Bhaiya, no problem. Guys, don't be panic. I'm here to support you. No problem. We'll have to do this thing several times. By mock session, even in your real exam, several times you'll have to practice. So it's a great opportunity, I think. And you're lucky that I am nominating you, everyone. Please uh, uh, do practice. Mahfuz, are you here, Bhaiya? Firdos?
yes.
Yes, very good. Okay, very good. So, so have a look. This is the inner cleft. So I think this is the which sided? Which sided? Right or left? This is the left side. Now tell me what is number one? What is number one?
Gluteus maximus.
Yes. Now tell me from what is the insertion of the gluteal maximus?
Gluteal line
Gluteal,
of the
gluteal tuberosity of the
Tuberosity?
femur.
Yes, very good. Excellent. Now tell me what is number two?
Gluteus medius.
Yes, and gluteus medius had been cut from here and it has been reflected. So this is the reflected portion. So what is number three?
Gluteus minimus.
Yes, excellent. So this is basically the gluteal trochanter of the femur. Now tell me what is number 11?
piriformis muscle.
Excellent. And which structure is coming above the piriformis muscle?
Supragluteal nerve and vessels.
Yes. Always remember the nerve will how to identify in the cadaveric picture. I have told you several times. Nerve will be shiny, and several branchings, several branch.
Several branches.
Yes, and the vessels, especially arteries. I told you.
Thick and tubular also good. Thick, tubular and shiny also.
And looks shiny.
Yes.
Thick tubular looks shiny.
And veins are
Vein will be dark,
Look blackish, dark.
and dark
And
structure.
so
thin.
if it is dark. Now tell me what is 17 and what is 18? So this is the shiny and
17 is superior gluteal vessel artery.
Nerve.
yes,
And
no, it's not the nerve. It has no branching basically.
It is supragluteal artery.
Yes, supragluteal artery.
and 18 is vein.
Yes, supragluteal vein. Excellent. Now tell me what is number 6? The piriformis muscle.
Inferior gluteal artery.
Yes, artery. And the darkest one, number 7.
Inferior gluteal vein.
Inferior gluteal vein. Okay. Excellent. Now tell me here, what is number 15?
Sciatic nerve.
Sciatic nerve.
Sciatic nerve.
Sciatic nerve. This is enough from this picture. It's very important. You'll have to remember. Don't go for all other structures. No, it's not needed. Only the structure we are discussing. So I think we have covered the most important muscles. Those are gluteal maximus, gluteal medius, and the minimus. What about the nerve supply? What about the origin, insertion, and innervation? Function is left. I'm just discussing it right now. Rest of the structure, especially piriformis, is also needed. We already discussed. Rest of this muscle these are not that much important. If you want, you can have some idea. Now we are discussing about the function. Just have a look. From this is the area, posterior gluteal line. From here, the gluteal maximal muscle originates, and this is inserting in this part. And this is the back of the patient, right? Just simply think, you are pulling this muscle. This is the insert, this is the origin, and this is the insertion. if we're pulling this muscle like this way towards the origin, so what about the hip joint? Will be the flexion or extension? Will go forward or backward?
Extension.
Yes, extension of the
Backward.
extension of hip joint.
Hip joint.
And there is a ball like situation. Now you are pulling this thing towards this thing. So will be there any rotation, external rotation, or will be there rotation towards the internally? Internal rotation or external? External rotation. Very good, guys. So if you are asked what about the function of the gluteal maximus, someone tell me. Number one is the extension of the hip joint
and external rotation
of the hip joint. Very good. And the external rotation of the hip joint. Okay. Now come to the so the two muscles. Have a look. This is the medius and this is the minimus. These muscles are originating and inserts into the greater trochanter. So if this muscle simply pull this like this way, what about the hip joint? Will go like this way. So if hip goes like this way, is it called adduction or abduction?
Adduction.
Adduction or abduction?
Abduction.
Yes.
Abduction.
Ab means away. Ad means towards, right? So someone tell me, if this pull towards the origin, so what about the hip joint? Will be there adduction or the abduction? Abduction. Now it's okay. Abduction. So remember, think this is the person, this is his body, and this is the face, and this is the limb. Okay. If the person is standing, in a flat surface, and if I do ask the patient or person to abduct his hip joint, these two muscles will work. That means if a person is standing in a flat surface and if I ask to abduct his hip joint, the muscle that will work, that is called the gluteal medius and the minimus. Am I clear to you, everyone? Am I clear to you? Okay. Now the question is, the patient is walking. So when the patient is walking, this is the patient, and one leg is in the surface and another leg is away from the surface. That means on the air. That means while the patient is walking, one is on the floor or the surface which carries the weight, and another leg is on the air. In that position, have a look, like it is the right sided lower limb. In that position, the right sided lower limb is on the air. So no weight is transmitting through the right side. Am I clear to you guys?
Yes.
Am I clear too? So in that condition, as no weight is transmitting to the right side, definitely the right side of the pelvis should be should be pulled down towards the surface, right? There should be a bending. Like have a look. This is the pelvis. Patient's leg is away from the surface. So this line, in a normal person, this pelvis, like right side anterior superior iliac spine, left side anterior superior iliac spine should be lying the same line. As this leg is away from the surface, no weight can be transmitted through this leg. All of the weight is transmitted to the left side as it is on the surface. And pelvis is not sagging down because this gluteal medius and minimus causes contraction. The medius and the minimus causes contraction. That's why it is there. There is no sagging down. বুঝা গেছে ভাইয়া? আমরা কি বলছি, আমরা যখন একটা লিম্ব আমরা যখন সারফেসে রাখছি, তখন আমাদের অন্য লিম্বটা কি করছে, পুরো বডিটাকে ক্যারি করতেছে। সো যেই লিম্বটা সারফেসে আছে সেই সাইডটা কিন্তু স্যাগিং ডাউন হয়ে যাওয়ার কথা, কিন্তু হচ্ছে না নর্মাল পার্সনের, কারণ the side that is on the surface, on that side gluteal medius and minimus causes contraction and stabilizing the hip joint. Am I clear to you guys? Everyone, please let me know. It's a difficult thing to understand. Still, if you don't understand, then I will repeat again and again, because you will have the hip joint examination, and if you don't have a proper orientation, proper idea, you will be fall in a difficult situation. So you'll have to have a clear idea. Guys, am I clear to you?
Yes, Bhaiya.
Okay. So what will happen? Yes, someone tell me.
অপোজিট যে অ্যাবডাক্টর আছে তারা কি তখন কন্ট্রাকশন থাকবে নাকি তারা রিল্যাক্স?
There is no value, that is because that is on the ear.
ওকে,
That is on the ear. So have a look. This two muscle is supplied by which nerve? Which nerve?
Superior gluteal nerve.
Superior gluteal nerve. So is there any injury to the superior gluteal nerve, and the patient is walking, and the one limb is on the surface, will this muscle able to contract properly?
No.
No, loss
Yes,
of contractility of the
yes, ultimately that won't able to establish the hip joint. So if it fails to establish the hip joint, what will happen? Ultimately this side, affected side, will be sagging down, because it was prevented previously on the opposite side by the intact supragluteal nerve. Am I clear to you guys?
ইয়েস।
Am I clear to you? This is enough for this part, because we'll discuss this thing in the simulation mock, no problem. Okay, what is the action of the gluteal medius? During standing, it is a hip abductor, and during gait, gluteal medius together with the gluteal minimus supports the body, while is one leg in the air, preventing the pelvis from drooping to the opposite side. That means it prevents the drooping of the pelvis to the opposite side. Yes. What clinical sign is evident with
Bhaiya.
weakness? Yes.
If the right-sided superior gluteal nerve will damage, what will be occurred?
Right side superior gluteal
Which
nerve.
side will be which side will be sagging down?
You tell
Left.
me. You tell me. If the right sided injury and the patient is standing with the right side, and the left side intact side is on the ear. So tell me,
Mhm.
will the right sided gluteal medius and the minimus able to establish the hip joint?
নো।
No.
opposite will be
So
sagging.
the sagging down will be the opposite side. Am I clear to you? Am I clear to you?
That means intact side. Intact side.
Intact side. That means the sagging down on the intact side. So like have a look. This is the person, and this is the pelvis, and this is the right side, and this is the left side. The right, the left, and gluteal medius and supragluteal nerve injured on the right side. So the patient is standing with the right hand and right leg, and left leg is on the ear, and this sided supragluteal nerve injured. That means sagging down will be on the left side.
Left side.
Am I clear? Am I clear, everyone?
Yes, Bhaiya.
Because this sided gluteal medius and minimus can't hold the or establish the hip joint. That's why if this condition happens, patient lands his whole body towards the affected side to make a proper balance.
Yes.
Everyone, are you getting me? Please let me know. Mahfuz, Bhaiya, are you getting me?
That means they are maintaining the pelvis in a position.